still has a lot of the same moxie she always had. For example, when she was in the office for a visit, she had briefly out of rehab, and she was supposed to be transported right back to rehab with the van waiting. And I'm sitting in my office after seeing her. My office happens to look out onto Wilshire Boulevard, and all of a sudden I see a wheelchair tooling down Wilshire Boulevard and turning into a Mexican restaurant. She decided she was not going back without a taco.
That's right. That's right. And today we might pass a few stores on the way back.
Well, you're living your life, and I think that's a great message for everyone.
Yes.
A lot to accomplish still in terms of your medical future, but you mentioned the weight loss and wanting to have this confidence. And
I want the boobs done. I want the,
Okay,
I want the face done. I want everything done. I'm in LA.
So I want all of our focus to be on your health, but acknowledging these things.
Yes.
Okay.
Yes.
Because you need things to look forward to, and when the time is
I
right.
worked really hard to do that, and then it was like.
But hey, that's still all there for you. In fact, I want to introduce facial plastic surgeon Dr. Hooman Melamed, who joins us in the audience, and you have something that you would like to tell Abby.
Abby, I have been following you for past 2 years, and I've been watching your stories. And I have realized you went through a lot of heartache, a lot of stress, and I'm sure dealing with cancer, major surgeries, that what you've been going through, and it takes a big toll on the face. And what I want to offer you is an opportunity to turn the hands of the time back by about 10 years. So I'm offering you Simone facelift, that I can offer you taking 10 years back and make your face 10 years younger without going under major anesthesia.
Oh. When can we do it?
As opposed to traditional facelift, which may take about 8 hours, 6-8 hours of major anesthesia, I can turn the clock back in under 2 hours.
Wow.
And we can kickstart getting that confidence back.
Thank you. I'm taking you up on that. Absolutely.
This is a really big deal, though, because right after she finished her treatment, she really, and before actually she started filming the next season of her show, she really wanted to have plastic surgery. And it was actually decked up, and we were doing pre-op evaluations and all that, and the surgeons backed out because she has so many other medical conditions that
the night before.
When we discussed all of the limitations that they had to follow and the things they had to monitor, they got a little bit frightened about the circumstance and backed out.
Right.
It does, but the great thing about this is that there's no general anesthesia, so that the impact on all of these other medical conditions will be minimized, and so I feel pretty certain that that's going to be successful for her.
Yes.
And Abby, you said boobies. I heard it right here, and that's where I come in. I think we're going to start with the face with Dr. Simone, but
I need a reduction.
I know that you're suffering
and a
from
lift.
overly
but like all
large
the fat
breasts.
around the bra, like back here.
Well, we can take
that's
care
what
of
I
that
want
too
off.
at the same time with liposuction. But we want, let's do the face first.
Okay.
We want to make sure that you're medically all tuned up. I need him to check off all the boxes for me, but I'm telling you right now that and you have to check off the boxes too,
wait,
Dr. Melamed.
No, he's gonna say.
Use for her too. I actually happened to look at the scans that was done, the MRI, and so I saw everything. The spinal cord is wide open, but another more important thing was that you and I were concerned that you may need further spine surgery because her spine may be collapsing and she may be coming like that, but all the alignment looks excellent. So everything is looking very good right now.
Good. So another thing to look forward to, that we will take care of those overly large breasts that you're suffering with, shoulder pain, back pain, neck pain, postural problems, irritation of the skin, fitting clothes. We can address all that when you're medically ready.
Yay!